modern day anesthesia make you believe that while operating there will not be any pain, and while operating I give a cocktail of injections inside the knee joint to control the pain post-operatively, and at the end of the surgery an expert anesthetist will give you a beautiful nerve block so that there will not be any pain post-surgery. And there are a lot of medications which can be given post-operative period to control the pain. Age does not matter. It's only which matters is you should be fit for the anesthesia. So any age group where they find difficulty in knee and requires surgery can undergo surgery provided they are anesthetically fit for the surgery. My youngest patient whom I operated is 45 years and my oldest patient is 84 years who underwent successful knee replacement surgery. Any medical conditions like diabetes, high blood pressure or cardiac problem is not a bar or a hindrance to undergo a knee replacement. Usually what I do is pre-anesthesia checkup is always done for every patient who wish to undergo a knee replacement surgery, which includes blood, ECG, chest X-ray and echocardiogram. If all the reports signals yes, then only we will plan for the surgery.